On this Friday night, new variants and sobering new predictions.
We could see a third wave that is even worse.
Plus, how health officials are divided on lifting lockdowns. Quarantine quarters, the rules, the loopholes, and the real cost. Kids who are COVID-19 long haulers.
My, face is twitching now.
The months-long struggle with lingering symptoms. And help wanted in space.
We need new astronauts.
How Canadians can apply for an astronomical opportunity.
Global National with Donna Friesen. Reporting tonight, Robin Gill.
Good evening and thank you for joining us. There's a new warning tonight about the highly contagious variants and fears they could drive a resurgence of COVID-19 infections across this country. New modeling shows there are fewer than 33,000 active cases in Canada right now, a 60% drop compared to a month ago, and deaths are down 58%. But the spread of dangerous mutations threatens to reverse that progress. Canada's Chief Public Health Officer says a more stringent approach is needed.
Current community-based public health measures will be insufficient to control rapid growth, and resurgence is forecast.
In January, at the peak of the pandemic, Canada had 8,000 cases a day. Now factor in the variants, and Dr. Tam predicts we could have 20,000 cases a day in a third wave. This is a frightening picture as vaccine distribution finally ramps up. Abigail Bimman has our top story.
Can everybody hear me? Just wave if you can hear me.
World leaders at their first virtual G7 meeting. They're just like us.
Can you hear us, Angela? That's okay. That's all right. I think you need to mute.
Prime Minister Justin Trudeau attended the event hosted by the UK, where COVID-19 cases have been falling after grappling with a more transmissible variant.
These variants have been smoldering in the background and now threaten to flare up.
Here's how variant cases have been climbing in Canada. New modeling shows case numbers, hospitalizations, and deaths are all falling across the country. The exceptions, Newfoundland and Labrador, where the spread is blamed on a variant, and Nunavut, but no variant cases have been found in any territory so far. The country's top doctor warns if variants spread and public health measures are lifted, cases could hit 20,000 a day next month. Compare that to the latest daily total, 3,300 new cases.
A resurgence is very likely if people let go of the public health measures right now.
We could see a third wave that is even worse than the second or the first.
Given many provinces are lifting restrictions as case numbers fall.
The premiers and I spoke last night about not opening up too fast.
The Prime Minister was asked if he told any of them to slow down on that call. He didn't answer, saying it's his job to support provinces.
We need to make sure that even as provinces look at loosening up certain restrictions, that other restrictions are kept in, and that there is an ability to both respond quickly when variants appear, and also an ability to use rapid tests.
Dr. Tam said any reopening needs to be done carefully and only if sequencing, testing, and contact tracing are all in place. Robin?
Abigail Bimman in Ottawa. Thanks, Abigail. The Ontario government has extended its strict stay-at-home orders in 3 of the province's COVID-19 hotspots. Toronto, Peel Region, and the North Bay area will be under lockdown for at least another 2 weeks. Infection rates are high, and there are major concerns over how more transmissible variants are circulating in the communities. But as Eric Sorensen reports, there's a real divide among some health officials over when to reopen.
Ontario is a case study in the debate to open up or not. One more region, York, is moving from lockdown to red zone, allowing openings with restrictions for retail shopping and indoor dining. The region's medical officer of health says it's the right call.
We've been actually seeing a decrease in the numbers of cases that we have, and our incidence levels are now compatible with us being in the red zone.
But right next door to York, a very different message from health officials in Toronto and Peel regions. They want no changes yet, worried about the threat posed by COVID variants.
By the time the confirmed case counts are big enough to shock us, it will be too late to do anything.
So the Premier left lockdowns in place for 3 regions.
They're on the ground, and it's my responsibility to support them, to support our municipal partners.
Ontario has seen a remarkable drop in the rate of reported COVID cases from a peak of 167 per 100,000 population in early January, down by more than two-thirds to 53 last week. Compared with the Ontario average, many regions have rates lower than that. But Toronto and Peel still have significant numbers of COVID cases, and variants put a big question mark over what lies ahead. It's prompted a rare divergence among public health officials. In York,
we are fairly confident that we are not seeing any explosive behavior amongst the variants.
While in Toronto,
the variants of concern mean we face a deceptively dangerous situation.
There are different realities in different parts of the province, absolutely.
This epidemiologist says it's a strange time. Health officials and politicians correctly see things getting better, but also possibly another wave before we're done.
We're entering a comfortable zone because, the worst of it seems to be over, but we're also entering a more dire period where that threat of the third wave is real.
Dion Anden and other experts are, on balance, becoming more optimistic.
There are things that we need to continue to monitor, variants being one of them. We should respect these things. But I think in the big picture, we are in a very good spot.
The big picture, still some months from being fully developed. Eric Sorensen, Global News, Toronto.
Alberta is moving into a new phase of its vaccine rollout. As of today, people living in retirement centres or other senior supportive living homes are eligible for the vaccine. Starting on Wednesday, people over the age of 75 can receive the shot, as well as First Nations and Métis age 65 and older. Phase 2 of the vaccine rollout is expected to begin in April. So far, Alberta has administered more than 150,000 doses of the COVID-19 vaccine. Pfizer and its partner BioNTech have revealed new data that shows their vaccine can be safely stored at standard freeze temperatures. The companies say vials can last in pharmacies at temperatures between -25 to -15 for 2 weeks. Right now, the vaccine requires ultra-cold storage between -80 and -60. The change has been submitted to the U.S. Food and Drug Administration. If approved, it could help simplify distribution of the vaccine. Starting on Monday, all air travelers returning from non-essential international trips will have to isolate in an approved facility at their own expense. Today, the federal government released the list of 11 approved hotels where travelers will spend their mandatory 3-day quarantine. But as Mike Drolet explains, some Canadians have found legal loopholes.
This is our quarantine quarters.
Monica Gibbs isn't looking for sympathy after a winter with her 3 kids in Barbados. The Caribbean nation offered Canadians the opportunity to live and work virtually on an almost COVID-free island.
There's our...
And it was paradise until COVID-19 restrictions came into effect in January.
So you can only leave for groceries, doctor's appointments, or pharmacy. And this weekend is full lockdown, so you actually can't leave your property.
She was already thinking of returning when Prime Minister Justin Trudeau announced on January 29th all travelers flying into Canada would have to quarantine for up to 3 days. It was mandatory, and Trudeau warned it would be expensive.
Travelers will then have to wait for up to 3 days at an approved hotel for their test results at their own expense, which is expected to be more than $2,000.
The rules are strict. Only travelers who don't have symptoms can go outside for limited and monitored outdoor time.
Well, I'm comfortable saying that 100% of my client base wants nothing to do with this hotel quarantine that goes into effect.
The only way around it is by applying for compassionate grounds or by driving over the border. Call it a loophole, but it's legal. And with no direct flights from Barbados to Toronto, the Gibbs family is flying into Buffalo, New York, where they have to take the second of their 3 PCR tests. And instead of going back to the airport for a short flight, they hired a shuttle to drive them home, where they'll quarantine.
I don't want to be locked up in a room with my 3 kids for 3 days. That doesn't sound right.
And remember that $2,000 Trudeau quoted? That's not right either, because the government is now saying the hotels set the rates. We called, and the average is around $450 per night for 2 people.
Not to say that's not a lot of money, but it is not coming in at what was the initial comments and put fear into a lot of people.
The rules go into effect on Monday. Will these hotels be full, or will Canadian travelers find a workaround? Mike Drolet, Global News, Toronto.
The federal government is extending several benefit programs to help Canadians deal with the economic fallout of the pandemic.
we're going to increase the number of weeks of benefits available for the Canada Recovery Benefit, the Canada Recovery Sickness Benefit, the Canada Recovery Caregiving Benefit, and Employment Insurance Regular Benefits.
The announcement comes as some Canadians were expecting to be cut off next month. The programs will be given extensions between 12 and 26 weeks. The government says the beefed-up benefits will cost $12.1 billion. Older adults are still the most vulnerable to COVID-19, but there's growing evidence that the virus has a significant impact on children. Researchers are finding that initially mild infections can have long-lasting effects on kids. Here's Heather Yerkes-West.
Alyssa and Emily Smythe became ill with COVID-19 last fall, just after their mother, a first responder, tested positive. 13-year-old Emily had only a mild illness.
I had a stuffy nose for about 12 hours, and I had a cough for 2 to 3 days.
But several months later, 11-year-old Alyssa is still experiencing symptoms.
My knees are the worst, but all my joints hurt. And it's mostly when I'm active.
Never did we dream that we'd be dealing with symptoms 4 months later.
Alyssa is one of a growing number of children experiencing long COVID, a condition first observed among adult patients where symptoms persist months after an initial COVID-19 infection is resolved.
It's known in adults that many people who have long-haul symptoms weren't hospitalized, so it's not that it's associated with more severe disease.
Mild initial infections have also been connected to the COVID-linked multi-system inflammatory syndrome, also known as MIS-C.
We kept telling her, you can do it, you can do this. And then at one point she said, Mommy, I can't do this.
In the U.S., cases of MIS-C are rising. In Arizona, 12-year-old Elizabeth English died in early December. The condition, which emerges several weeks after an initial COVID infection, is still considered rare, but Canadian doctors say they're seeing cases here more and more.
We've had over 130 patients now that we've cared for at Sick Kids with MIS-C during both the first and second wave. This wave, the kids have needed a little bit more intensive care treatment.
It's why Dr. Ray Young says it's so important that research continues so that vaccines can be approved for use in children soon as well. COVID-19 may not be as deadly for children, but there is growing evidence that the virus can have long-lasting impacts. Heather Yerkes-West, Global News, Calgary.
Canada's Defence Minister gets grilled. Coming up, the tough questions for Harjit Sajjan about the country's former top soldier. And beamed back from Mars, new pictures of the red planet. A House of Commons committee is looking into the allegations against Canada's former top soldier. General Jonathan Vance is accused of inappropriate behavior with 2 female subordinates. Several top officials, including Defence Minister Harjit Sajjan, were asked about what they knew and why there was no investigation. Our Ottawa Bureau Chief Mercedes Stevenson broke this story and has been following the hearings. Mercedes, what did the Defence Minister have to say today?
Well, Robin, there were more questions than answers by the Defence Minister at the committee. He wouldn't answer questions from members of Parliament that included basic information like what he knew, when he knew it, or who the minister told it to. As Global News has reported, the military ombudsman approached the minister in 2018 to raise concerns about General Vance's behavior around women. We've heard from sources who say that Sajjan's office emailed the Privy Council office to let them know about it. But we haven't been able to find out who knew more, whether the Prime Minister was informed, which he's refused to answer, or what exactly the Defence Minister told him. You could see the frustration from MPs at committee today who pressed the minister on whether it is him and his actions that are under investigation or General Vance's. That's because, as you'll see in this clip, the minister continually refers back to the military police investigation going on now as the reason why he can't answer questions about what he did.
I'm asking for you to confirm to me whether you knew or did not know about these allegations before they became public.
Madam Chair, I want to make it very, very clear here. I'm not implying anything. What I'm saying here is that the conversations and the meetings are confidential when it comes to the Ombudsman's office. But what I'm saying here is that any allegation that were any brought forward, we were always taken to the appropriate authorities.
No one's asking about the investigation. We're asking about your actions as the minister.
Bureaucrats from the Privy Council office also appeared. They were the office notified by Minister Sajjan's office about allegations. They said they didn't have enough information to actually act, raising the question mark of still why more wasn't done. We'll have more on the West Block this weekend that will further develop this story. Tune in. Robin?
Mercedes Stevenson in Ottawa. Thanks, Mercedes. Fire and ice. Still ahead, how fire crews battled a blaze in Texas with hydrants frozen solid.
You're watching Global National.
As you mentioned the fire chief didn't get a chance to explain that crews had to truck in water to fight a fire at an apartment building in San Antonio, Texas. The deep freeze gripping the state has frozen fire hydrants. The flames took over the building Thursday afternoon, raging for more than 14 hours. All 50 residents were taken to a nearby evacuation center. No one was hurt. The power is slowly coming back in Texas, but not the taps. Millions of people who endured rolling blackouts are now under boil water advisories. They're also relying on emergency rations after finding long lines and bare shelves at supermarkets. 2 back-to-back storms are being blamed for the deaths of at least 58 people across the United States. There's growing concern last week's earthquake may have caused more damage to Japan's Fukushima nuclear plant than initially thought. Water used to keep the plant cool has fallen in 2 reactors. That indicates there's a leak, but it's confined to the buildings. The new damage could further complicate the plant's already difficult decommissioning process, which is expected to take decades. In 2011, a powerful magnitude 9.1 earthquake and tsunami damaged the plant's cooling systems, causing a nuclear meltdown. A warning, this next story is hard to watch. Dozens of short-finned pilot whales have died in Indonesia despite a desperate rescue mission to save the pod. The whales somehow stranded themselves on a beach on the island of Madura. Volunteers tried to push the mammals back out to sea, but only 3 of the 46 whales could be saved. Witnesses say some calves returned to the beach hoping to find their mothers, and the young whales couldn't be saved. It's not fully understood why whales beach themselves, but they are known to be highly social and travel in large groups. Astronaut ambitions? Up next, a space agency is hiring, and Canadians can apply. Prince Philip has spent a 3rd night in a London hospital. There are reports he will stay there until early next week out of an abundance of caution. The 99-year-old was feeling unwell and admitted to hospital Tuesday. Prince Harry and his wife Meghan have made their final formal split from the royal family. A statement by Buckingham Palace says while we are all saddened by their decision, the Duke and Duchess of Sussex remain much-loved members of the family. The pair has stepped away from full-time royal life last March and won't be returning to royal duties. Harry will also lose his honorary military titles. We're getting a sneak peek from Mars tonight. NASA's Perseverance rover has sent some incredible images back to Earth. This image, captured moments before Perseverance touched down, shows dust plumes created by the rover's engines. And you can really pick up the color of the red planet in this high-resolution image. It's a revolutionary time for space exploration, an era that is inspiring the European Space Agency to expand its roster. Today, it put a call out for new astronauts. The agency says the ideal candidate should have a master's degree in sciences or mathematics, be between the ages of 27 and 37, and the best part, Canadians can apply. As Crystal Gumansing reports, the job will expand their horizons.
Astronaut is a top career pick for kids, but the dream of suiting up doesn't have to fade with age.
It's an amazing journey. I think it will be an opportunity to learn a lot about yourselves, your strengths, your weaknesses.
It's the first European Space Agency recruitment drive in 11 years. The process for candidates will be arduous, including 6 stages of tests to challenge scientific, technical, and mental fortitude.
We have astronauts from the last selection, and they are still active astronauts, and I would like to see them again going into orbit, going into space, But at the same time, we need also new astronauts to secure a continuity.
3, 2, 1.
With private companies such as SpaceX, the prospects have increased for more human missions.
It's time to guide the capsule.
Space singing Chris Hadfield re-energized the image of an astronaut.
This is Major Tom to ground control.
It's not just the next Major Tom, but Major Tammy that the ESA is looking for. The agency strongly encourages women to apply.
We expect and we hope that thousands of people will apply. The chances of success are slim. But I think it's a great opportunity.
Canada has a cooperation agreement with the agency, and the recruitment process is open to those from member and associate states.
To be part of this international team that can actually make a real difference is a real privilege, and it was that really that motivated me to want to be part of this team.
A team doing a job where the possibilities are literally out of this world. Crystal Gamansing, Global News, London.
And that is Global National for this Friday night. I'm Robin Gill. Tonight, Your Canada is this snow reptile in Beaconsfield, Quebec. We'd love to see your corner of the country, so please keep sending your photos to viewers at globalnational.com. Thank you for watching, and I'll see you back here tomorrow. Have a great night.